Please welcome to the stage APA's Senior Director of Strategic External Communications and host of APA's flagship podcast, Speaking of Psychology, moderator Kim Mills.
Good morning. A few weeks ago, I did a Speaking of Psychology podcast with Dr. Tom Griffiths from Princeton, who talked about the differences between how people and artificial intelligence systems learn. And there's at least one area where humans are still superior. We can glean a lot from small amounts of information, whereas AI systems only learn by hoovering up huge quantities of information. However, given the pace at which AI is being developed, we humans may soon lose our edge. So is AI the next frontier of technology, or is it the beginning of the end of humanity? AI is already becoming a part of our lives and our field. It will change how psychologists conduct research, treat patients, deliver interventions, and teach students. AI holds the promise of reaching vastly larger numbers of people to treat illness and promote mental health. It can analyze staggeringly large data sets to create and deliver more targeted and efficacious therapies. AI has the potential to do great good, but also great harm. This leaves many concerned, and not without reason. Some clinicians fear that the human interaction essential to effective therapy will be lost if patients begin turning to chatbots instead of humans. Many professors foresee students failing to learn if they're entering keywords into generative AI systems like ChatGPT or Bard, and then sitting back as their 5-page paper writes itself. Researchers worry that society's biases, which are already baked into AI systems by their inherently biased creators, will intensify the societal problems our field is trying to solve. And beyond the field, how will AI affect our lives? The big tech companies have already shown us that there is much to be feared when outsized egos powered by piles of money are left unfettered and unregulated. But there's hope on the horizon. Recently, 7 of the most prominent AI companies agreed to work with the White House on voluntary safeguards on their technologies. This is a start, and it's also an important public acknowledgement of the responsibility developers bear for their creations. Another bright spot is that psychologists are working with big tech companies right alongside the tech innovators to make these products the best that they can be. So I'm delighted to welcome one of these psychologists to our main stage this morning. Dr. Sethumadhavan has an undergraduate degree in computer science, a PhD in experimental psychology with a specialization in human factors and ergonomics, and more than 18 years of experience studying human technology interaction. This includes tackling issues of privacy and consent, fairness, inclusion, accountability, and transparency as they all relate to AI experiences. She also directed human factors research for several novel and complex applications, such as Microsoft's custom neural voice and facial recognition technology. Part engineer, part psychologist, Dr. Sethumadhavan has harnessed the perspectives of more than 13,000 people, many from underserved communities, to help shape the ethical development of AI and emerging technologies. She was a fellow at the World Economic Forum, where she surfaced opportunities for AI to help address the needs of our aging global population. Before joining Microsoft, Dr. Sethumadhavan worked on creating human-machine systems that help people be effective in complex environments in aviation and healthcare. Please welcome Dr. Arthi Sethumadhavan.
So I wanted to start off with some basics on AI. So let me start with what AI is. And pardon me if you're already fluent on the topic. AI actually refers to computers that can actually mimic the problem-solving and decision-making capabilities of the human mind. And it can reason, learn, and act at a scale that far exceeds that humans can analyze. And machine learning is a subset of artificial intelligence that enables computers to learn from data and perform tasks without being explicitly programmed, right? So it learns from repetition, it learns from data. And deep learning is a subset of machine learning, which is actually inspired from your brain's neural networks. And by using these machine learning and deep learning techniques, you can actually build a lot of applications, right? Image recognition. So if you've seen your face recognition systems at airports, you have actually seen AI, right? Speech recognition is another example. So if you've ever said, hey Siri, or okay Google, then you've used AI. Language translation, if you've ever used Google Translate when you were in a different country, then you've used AI. So AI is actually much more ubiquitous than one actually thinks it is. And with these advancements in machine learning and deep learning, there have been fantastic breakthroughs, right, across industries, be it medicine, be it animal conservation, be it retail, be it agriculture, and even human rights, right? So it's quite amazing, actually. Now, generative AI is quite the buzzword at the moment, and generative AI is a subset of artificial intelligence that actually uses techniques like deep learning to generate net new content. So that's what's unique about this sort of AI, is that it generates net new content. So for example, you can use it to create text, music, video, imagery, and so forth. So it's quite amazing, actually. And what it does is it uses massive amounts of pre-trained data sets to generate the new content. So what you see on the screen here is actually a poem that I generated about APA with ChatGPT. So ChatGPT is a popular generative AI model created by OpenAI, and the prompt that I entered was write an 8-line poem about the American Psychological Association. So that's what you see on the screen. It's a bit cheesy, but you get the picture. And on the right is a product called Imagine, which is a Google model. And what it does is it takes text input and generates an image. So the prompt used here was a photo of a raccoon wearing an astronaut helmet, looking out of the window at night, and this is what you get. And it's very photorealistic, as you can see. Now, I do want to say that we are no longer looking at technology, though, in a very blind, simplistic sort of utopian view, right? A lot of technologies are being deployed without very little assessment it can have on people and society. In fact, a few months ago, this came out, and this was the image of Pope Francis in Balenciaga, right? And it was actually generated using a very popular generative AI program called Midjourney, and just by an average user, right? So AI-enabled deepfakes are making it very difficult for people to differentiate what is real and what is fake, and that's a huge issue, right? Biased algorithms is a huge problem. In fact, during the pandemic, this came out in New York Times, and when all the Black Lives Matters protests were happening across the country, Mr. Williams, portrayed here, was actually wrongfully arrested by the Detroit police due to a flawed match from a facial recognition algorithm. So these problems are real. This was a news that I came across just a few months ago, and it was where the spotlight was on a tool, which is actually a child welfare tool used in the state of Pennsylvania to spot child abuse. And the Justice Department is actually scrutinizing and investigating into this tool at the moment because they think that the algorithm might have actually violated American Disabilities Act by discriminating against families with disabilities, right? Because an algorithm is only as good as the data that goes inside it. This is a paper that was published by OpenAI and the University of Pennsylvania researchers a few months ago, and what it's kind of showing is the impact of these large language models on jobs. In fact, what they say is 19% of the American workforce will have at least 50% of their jobs impacted by AI. And there are certain industries which have the highest risk of exposure, such as mathematicians, journalists, writers, accountants, and so forth. So there's a huge impact, most likely on higher paying sort of roles, right? And similar work was actually done by Goldman Sachs economists as well, and they also think that this would bring about a disruption in the labor market, and with white-collar workers being at more risk. This was a survey done by KPMG just a few months ago, and it was done with people from 17 countries around the world, right? And what this shows is that about 60% of people across countries are wary about trusting AI due to various factors like fear of cybersecurity risks, fear of de-skilling, biased algorithms, and so forth. Now, I didn't say all of this to create fear in any of you, but it's rather to present a comprehensive view of the situation, right? And it's really to acknowledge that we're actually designing societally complex systems. These have huge impacts on people. So it's very important to acknowledge that, right? In fact, in my career, what I do is ask questions that help shape these technologies responsibly. So the kind of questions that I ask are things like, how will face recognition technology impact minority communities? How do we address human rights challenges? How does generative AI impact the creative community? How should we be thinking about the economic impact of these systems? How will we protect the privacy of bystanders as we are designing augmented reality sort of experiences? Are we excluding certain groups of people from getting the full benefits of the AI, like speech recognition systems? How do we collect data from vulnerable communities in a manner that we are not exploiting them? So these are sort of the questions that I ask on a daily basis. And the only way to address these sort of questions is by putting people at the center of everything, right? And by people, I mean people who are the end users of these technologies and whose jobs could be impacted by these technologies. And what you see on the screen is actually a snapshot of some of the communities I have interacted with while developing products. And as you can see, it's quite diverse, right? And bringing those diverse perspectives is very, very important. And diversity is not just one thing. It's not just about your gender or your ethnicity. It's a lot of different things. It can be your profession. It can be whether you have visual and mobility impairments. It can be your privacy views. It can be your personality type. All of these have a role to play depending on the context and the type of technology being developed. So psychology plays a very, very important role in my work. I'm always borrowing and examining core concepts from psychology, such as automation bias, well-being, trust, all these things. In fact, when I was working on face recognition systems, I was looking at value exchange, which is how do people perceive the benefits against the harms of technology? How do we design mixed reality headsets that prioritizes existing social norms and respects that? And how do we prioritize interpersonal attention? So I'm always borrowing things from psychology. So what I want to walk you through are 5 different steps that psychologists who end up working in AI or who wants to work in that space can do to help shape AI in a responsible way. And the first is about really about engaging the impacted stakeholders. Let me walk you through a quick example. In fact, 2 years ago, Microsoft released a new product called text-to-speech. And it's basically the idea is that you can take 500 to 1,000 utterances of somebody's voice and convert that into a voice font which uniquely represents you. So it's extremely realistic sounding, right? In fact, the realistic nature of the voice is amazing because it can be used to represent brands and personify machines, make interactions with a digital agent really fun and interactive. So fantastic applications, be it audiobooks, museums, etc. However, a question for us when we were working on this product was, how would this technology impact people, especially whose jobs could be affected by this tech? So what we did is we conducted interviews with voice actors from various industries, from audiobooks and television and radio, and they had concerns about job loss. They wanted ways to control how their voice could be used. They expected transparency from tech builders. They expected royalty each time their voice is synthesized, and so on, right? In fact, the quote you see on the screen was actually from a voice actor from our in-depth interviews, which clearly shows the fear of economic displacement. So what this helped us do is actually create an explicit terms around the terms and conditions of use of the service, which meant that anytime the voice of a voice actor is synthesized, explicit disclosure and permission need to be obtained from them. Otherwise, you don't get access to the feature. The next area where psychologists can play a really important role is by engaging in continuous feedback loop with end users. And in this particular example, our goal was to really create an enrollment experience that people felt good about, right? And this was using face recognition technology to access buildings. And people had all these questions, right? What's in it for me? Is this going to track me everywhere I go in the building? Who has access to my data? For how long? What happens to my data when I leave my place of employment? Very legitimate questions from people. We use those insights and a framework around meaningful consent to actually come up with a subjective and objective measurement method to design an enrollment experience that people actually felt good about. So again, you see how I'm applying psychology here. It's again, borrowing principles from your experimental design 101, right? The third thing I would say is ethical data collection, and here psychologists can play a very important role. For context, AI systems need a lot of data. It can be your face, it can be skin tone, it can be eye tracking, it can be gestures, it can be speech, it can be a lot of different things. And a lot of my work has actually involved providing guidance to product teams on every phase of the data collection, from obtaining informed consent, qualifying suppliers, collecting demographic data, recruiting from vulnerable groups, and so forth. And all of this has taken years to develop by embedding ourselves with the product team and interviewing people who are actually conducting these collections in the wild and doing lots of ethnographic observations. Again, ethical data collection is part of the core training of psychologists. The fourth thing I would say is helping create sampling strategies. In fact, how do you create data sets, right? In fact, I was in a project which was really aimed at increasing the representation of African-American speakers in speech recognition data sets, and that required me to really think through migration patterns in the United States and where do African-American speakers reside, because there is no one thing as speaking in African-American vernacular English, right? The Northeast corridor is very different from the West Coast and so forth. So coming up with a very rigorous sampling strategy, which includes regions and age differences and gender and whether you're in an urban or rural area, all of this was important. And again, this is something that psychologists have been doing for years, right? Like thinking about sampling techniques. Lastly, I would say is helping teams succeed. We need to acknowledge that people are responsible for developing systems, right? And oftentimes they're under real time pressure to deliver products, right? There's a lot of pressure put on them. So it's very important to create best practices that people can actually integrate into the project workflow. And this is another area where psychologists can help. I've also created a lot of best practices along those lines, from community jury to self-identification to social acceptability. Now, to close out, I want to take a step back and talk about the big picture, right? We need to recognize that technologies don't have to be used today the way we use them today, or even how Hollywood or technology makers envision of them, right? Instead, technology must be very much focused on meeting the needs of people and lead to a sustainable future and promote human flourishing. And for that, we need to enlist the perspectives of a wide array of people. And here, I think, is a unique opportunity for psychologists. Thank you so much for listening.
Please welcome back to the stage moderator Kim Mills.
to say thank you to Dr. Sethumadhavan. That was really fascinating. Now we're going to shift our focus to the ways in which AI tools have the potential to address the mental health crisis in the US by making mental health care more accessible and less expensive, reaching audiences that traditional therapy cannot reach. However, right now many AI tools are being developed without psychologists' input, and concerns remain around issues in AI such as bias, as I've mentioned before, a lack of regulation, and ensuring that these tools are based on sound psychological science. We'll be talking about the current state of AI and mental health, how AI can expand access to care, and streamline some aspects of psychologists' work, and why it's so important for psychologists to be involved in this field. I'm pleased to be joined by two psychologists who are innovators in technology and mental health. Dr. Jessica Jackson is an award-winning psychologist and mental health equity advocate. She's the clinical strategy manager for Modern Health, a mental health benefits platform for employers, and runs a private practice in Houston. She's also chair of APA's Mental Health Tech Advisory Committee and vice chair of the board of directors of Therapists in Tech, a global organization for digital mental health leaders. Dr. Jackson is a scientist practitioner whose research areas include race-related stress, minority mental health, cultural factors that impact mental health, and stigma. Our second panelist is Dr. Vail Wright, Senior Director of APA's Office of Healthcare Innovation, where she focuses on developing strategies to leverage technology and data to address issues in healthcare. These include improving access, measuring care, and optimizing treatment delivery. Dr. Wright is a licensed psychologist, and she serves as a lead spokesperson for APA. She's been interviewed by scores of media outlets, including NBC News, The Today Show, The New York Times. You may have seen or heard her in one of these places. And some of the topics she has covered include stress, serious mental illness, telehealth, and technology, and access to health care. Please join me in welcoming Dr. Jackson and Dr. Wright. So I'd like to start with a question for you, Dr. Jackson, about the promise of AI. As we have said, AI has the potential to deliver mental health interventions to people who don't have access or can't afford therapy, people psychologists might otherwise never encounter. Can you talk about that? Is this a good thing, essentially?
I believe it's a good thing. One of the things I get most excited about is thinking about the fact that everyone knows we have a finite number of mental health clinicians. They cannot do one-on-one therapy in addition to destigmatizing work. It takes a lot. So using AI for things like chatbots that people can connect with at first, even as a low barrier, or low entry point to get to therapy, is a great thing. Somebody who may have never considered therapy could be for them, but they're having trouble sleeping, and they go on a website and they're able to have a conversation with like a chatbot about sleeping, might help them to feel more comfortable to go and see someone to really address the issues that are impacting their sleep. That's not something a therapist could do. A therapist is not going to be on call at 1 a.m. to talk to somebody about here's why you should come in and see me. So I get really excited about that. And the second part I get excited about that I think is a wonderful thing is when we think about access and cultural competency. This is a way to help train clinicians to be able to provide services that feel more culturally relevant for everyone. If you could have a program that does cultural humility and in the moment train therapists as they're sitting with a patient saying, here's what you're missing, here's what you should be asking, here's what you can help someone with, that person may feel more engaged. And we know that for many marginalized communities, they will stop going to therapy. Engagement rates can be low, which then impact outcomes. So we can help improve engagement. We help improve outcomes for many communities that don't always get included in services like this.
Well, I want to ask you both why it's important for psychologists to get involved in developing AI mental health tools right now. Dr. Wright, let's start with you.
Well, the reality is it's happening already, whether we join it or not. And the danger is that you could see a proliferation of these types of tools that are at best just don't work, and at its worst actually do harm. And I think that's really where psychology and psychologists can come in and play a role. We've been trained in rigorous and robust research methodology. We are the experts in behavioral change, and we have at our core an ethical code. And I think we can bring all of these skills to the development of these tools in order to reach the people that Dr. Jackson was just talking about. The reality is we are in a mental health crisis, and no matter how you do the numbers, there will never be enough providers to meet the need. And so while we have to continue to support and grow the workforce, we need to think more innovatively. And yes, that includes things like prevention and integration and meeting people where they're at, but includes technology too. And I think the more that we can embrace that idea and see it as a tool and not a threat, then we have a significant role to play.
And is that, do you agree with that? And what about the issue of whether it's a tool rather than a threat?
I absolutely agree with that it's a tool. I'm a big fan of the fact that if anyone's ever heard me talk anything about psychology, I'm like, we're at a point we have to reimagine what it means to be a psychologist. We cannot take new technology and put it into the old way. So we have to think about how do we work collaboratively? How can this actually help us to be better clinicians, researchers, trainers, and really using it as that tool. And the great thing about technology and AI is it's being built, so we can actually impact how it is built to support the work that we're doing, the more that we get involved. And to Dr. Wright's point, it's being built with or without us. So the more that we're able to participate, the more that we can have a say on how to build it in a way that feels ethically responsible for ourselves and for our patients.
So as you both said, some psychologists are already working to develop AI tools and apps. And I'm just wondering, who are some of the innovators? What are some of the apps they're developing? Can you talk about, for a more practical standpoint, who's doing this work and what is it that they're building?
There's a lot of companies. I think last check, there was something like 10,000 mental health apps that exist, and that's not including AI or virtual reality or any of these other things. So there are tons and tons of people doing this work. There are people that are building things, for example, like EMRs and using AI. So there's things like Upheal or Ilios, or I think Happify does it as well, where they're helping people to really think about, for clinicians in your note taking, what are themes that can be pulled out? So they can listen to a session, you can upload a session, and they address things like data privacy on their website. But then as a clinician, you can go back and like, here are the themes that happened, or here are the words that stood out. So you can really think about in your note taking what you want to think about for next session. As clinicians in the room, it's really difficult to think about all of that and to monitor time and to monitor what's happening non-verbally and all of these things. So it's a tool to help. I think other things that are happening, you have like Weibo, who's doing chatbots. There's a lot of companies that are building things that are complementary programs. So things that can help support like journaling or CBT courses for sleep and things like that.
Yeah, I really think that the impact that AI can have on reducing administrative burden for providers is going to be a game changer. I think there's still a lot of questions that we haven't answered around privacy and security and data storage, but I think if we can do it right, I think it has the potential to not just make a clinician's life a little bit easier, but actually reduce burnout and maintain the workforce in a more robust, well-being kind of way. We're also seeing a lot of work where we think that's going to have a lot of impact is in digital therapeutics. So these are software apps generally that deliver evidence-based, clinically validated treatment programs. And what makes them different than just the apps you can download from the App Store is that because they purport to treat, diagnose, or cure disorders, they're actually regulated by the FDA. And so I think that's another space where we see a lot of psychologists putting their mark on. We've got companies like Big Health or Achille that have a large psychological presence, and I think that's why they are demonstrating some of the best evidence that these products really work.
And are there many of these out there at this point that have been approved by the FDA, or are we still waiting for that to happen?
It's a relatively small subset that's actually gone through the formal FDA clearance process. Part of that is because during the pandemic, the FDA allowed many of these products to go straight to market before going through the clearance process. Now that the public health emergency has ended, we anticipate that many of these products will go through the appropriate clearance process and then be again sort of formally regulated by the FDA.
Dr. Jackson, are there any out there that you're recommending right now?
I don't know that there's any that I would specifically recommend in the way of like, I think people need to review what works best for them. I think there's so many, and for people to really think about what's working best for my practice, for my trainees, even for research. I think sometimes people think that the digital therapeutics and the apps are only for clinicians, but I think researchers can learn a lot too about how they're thinking about the work they're doing, how it can be applied to an app or how it can apply to a digital intervention. So I think there are plenty of apps for people to really take a look at and really examine and see how it fits with the work that they're doing.
And for consumers, how do they know that their privacy is being protected?
That's a tough one.
Yeah. Yeah. I think they can read what's on the website. I always encourage any patients that I'm working with or anybody who's a consumer of them, if you're not sure, to reach out, to ask the questions, to say what is in the terms and conditions. I do encourage people, I know many of us will just click yes and not read before we move on, to really read what is there so that you can be an informed consumer. I think I see the role of many organizations to be able to help people to figure out what does data privacy look like, what does that mean for me? And I think the other thing is that realistically, we also have to balance healthcare as a business. So there are going to be apps who are trying to get your data to be able to sell it. That is what happens. And so I think that people need to really be thinking about that when they're using the app so that they can be informed consumers instead of assuming that everyone's just trying to do this for the greater good.
So let me ask you, Dr. Wright, the pace of innovation and development is quite rapid. And I'm wondering, what is APA specifically doing to explore the opportunities for psychology and psychologists to guard against some of these unintended consequences that could come about as a result of using apps and digital therapeutics?
And so as you mentioned in your intro, Dr. Jackson is the inaugural chair of APA's Mental Health Technology Advisory Committee. And the goal of that committee, which was started this year, was really to help us strategize where APA can have an impact, where to put our resources as it relates to technology and professional practice. We've also recently partnered with Big Health, one of the digital therapeutic companies I mentioned earlier, to help create education materials to really help individuals understand what digital therapeutics are, what they aren't, and how they might be useful in one's practice. We've also been working with our federal advocacy partners around advocating on the Hill and with the Centers for Medicare and Medicaid Services to help establish a reimbursement pathway for these digital tools. Right now, there's no way that providers can get paid to use them. And if we can't figure that out, then we'll see the scalability and the promise that we'll see. We've also been working with our science colleagues to create new pathways to engage new audiences. So we'll be presenting at the Consumer Electronics Show in January of 2024, including a series of AI talks. We've also been working a lot with our communications folks. As Kim mentioned, the Speaking of Psychology podcast came out. We have a Monitor article that came out. So I think the point I'm trying to make is that this is an issue, technology and AI, that spreads across the organization and across all of psychology. And I think that that's really critical because we have a lot to offer. And if we can be the leaders in this space, I think that that would just have such important impact to making sure that the tools that are being built are both efficacious and also safe.
So many psychologists and probably people in this room are eager to take advantage of some of the efficiencies that they could gain by using AI tools, but they're cautious about getting started. What are the tools available right now that people could use, walk out of this room knowing that they could safely use some of these apps in their practice?
I know one of the things that gets vetted rigorously is the VA has an entire suite of digital apps from everything for depression, suicidal ideation, to PTSD, and they've been working on these for years. And I think that is a really good place to start because there's a lot of research behind them. And a lot of them, because it's coming from the VA and the government, they're free, widely available. And there's a lot of people, they even have these like prescription pads to even help destigmatize. So people, when they go in and see a provider, they can check off. When I was a fellow at the VA, we used to give these out to people when we were in the primary care clinic and say, I can review the app right here with you. I would have it on my phone and be able to show them and say, here's a prescription pad that'll help you remember the name and what it can be used for. And I think that's a great place to start because of the amount of research that is behind those apps.
So, Dr. Wright, let me ask you, what are some aspects of AI technology that psychologists are right to be skeptical of, and how can they evaluate AI tools? What are the sources that individual psychologists can turn to when they're trying to ascertain what they can use, what they should use, and maybe some that they shouldn't be using?
Yeah, so as you saw in the first speaker's talk, there are things to be concerned about. Number one being bias. If you have bad data going in, then you're going to have bad AI coming out. Because AI at its core is really just algorithms based on whatever data it's been fed. And if it's sort of pulling data that is skewed towards one particular population versus the other, then you have the opportunity to have unintended consequences. For example, in a recent study that I saw, a hospital was trying to triage in their ER individuals who go to the front of the line, and they used healthcare utilization and insurance coverage as part of their algorithm. And so what it did is it bumped individuals either without insurance or without using a lot of healthcare to the bottom, and that's often individuals from marginalized communities. And so even though they might have had more severity. So I think, again, we have to be thinking about what these algorithms are and what kind of damage they could do. I think there's a lot of questions, particularly around generative AI, in terms of inaccuracies, potentially spreading false or misinformation. So I do think there are things we have to worry about. There are some sources, I think, that exist. One is One Mind Cyber Guide is a place that does rate a variety of these different apps, similar to the VA apps that Dr. Jackson was talking about. But there is a challenge. There is no regulatory body currently in this space. And that is something that we need desperately in order to really ensure, again, that these are safe and effective tools.
Mm-hmm. So are there any resources that you recommend, Dr. Jackson, if I'm trying to choose an app or a digital therapeutic? Like how do I evaluate besides just reading whatever that company may be putting out?
So APA, we used to have one that we would do reviews. So there's some reviews on the website. Of course, as I'm telling you all, the name of it is...
It's Let's Get Technical.
Let's Get Technical.
We're trying to bring it back.
Let's Get Technical is one of them that's been reviewing. So there's multiple reviews that are already up there of different digital technologies that have been reviewed by psychologists. And each one is reviewed by more than one psychologist to give different perspectives. So I think that's a great tool. I also encourage people to get involved in some of the organizations that are doing this work with clinicians and researchers, because there's ways to have conversations to see what people's experiences are. There's a Society of Digital Medicine, there's Therapists in Tech, Digital Health. A lot of those people can get connected and hear reviews from people who are either using it or who've worked at these companies who can share information that might be helpful for other psychologists.
On another note, Dr. Jackson, what about psychology training? How can these apps be used to train psychologists? And you mentioned cultural humility early on. Mm-hmm. Tell us about what you're seeing in this space right now.
Unfortunately, I'm not seeing a lot related to training. What I would like to see, a lot of what's happening now is focused on clinicians now and what they're able to do to be able to help patient care. What I would like to see is more resources that are available for training, because I think we do a disservice when we have graduate students who are not learning this and they're going to come into a world where they have to use this technology and they don't know. I think about it for myself. I grew up in the age of using Oregon Trail in elementary school. Like, that was my experience with the computer. And now we're using things like AI and all of these things. My niece is 4 and can use an iPhone. Like, it's so easy for her, right? Because that's what she knows, so she didn't have to learn it. Same way with trainees. I think we have people who are training them who are on the Oregon Trail side, and the graduate students are saying, but I can use an iPhone like this. So how do we help support them to get ready? I would love to see things like that are helping in the moment to give feedback. I think many clinicians here, when you're getting clinical training, you have either a supervisor who takes notes during a session and gives it to you later, or they have the one-way mirror, so they're watching you and then later telling you, but that doesn't help in the moment with patient care. You can't do anything about that till the next time you see them. So if we could utilize AI that could sense things in the moment and say in their ear, did you notice that this person got really tense while you were talking about this? This might be a good way to go. Do you notice that they're using this word multiple times? You should explore that. Or even for their own clinician to recognize their own bias. They mentioned suicidal ideation and you just tensed up. What message are you sending? And reminding people in the moment so that they can make changes in the moment to help affect quality outcomes.
So, like a lot of workers in other fields, people are concerned, psychologists are concerned, that AI may eventually replace them. And I'm just wondering, is that a legitimate worry? Should psychologists be concerned that they're going to be replaced by AI?
I mean, I think it's a very understandable concern. AI is not going to replace psychologists, and let me explain why. So let's take this from a historical lens first. It's in our nature to be nervous and uncertain when new technologies are introduced. It could be said of the light bulb, of the automobile, and we eventually get used to them. As we saw in the first talk, AI has been part of our lives for a while. If you've ever used Netflix or Prime Video, if you've ever talked to Siri, if you've ever used the auto prompts to finish a sentence in a message, you're using AI, and we've been doing that for a while. We just got pretty freaked out when generative AI went public, and in particular ChatGPT, and so it really became something that got our attention, and now we're paying more attention to it, which is a good thing. But as we saw in the talk, AI is never going to be able to do the nuanced work that psychologists need to be able to do in their face-to-face interactions. So again, AI is not going to replace psychologists. However, I do think it can become a differentiator, meaning that I think there could be a point where you have psychologists who don't use AI versus the psychologists that do use AI in some way in their practice, again, to reduce administrative burden, to address, to fill the gap of long wait lists, to measure outcomes, to determine quality, and using that data to either contract with insurance companies to higher reimbursement rates. So I think that there's a lot of promise, again, that AI can have. But again, I'll say this one more time, for the third time, AI is not going to replace psychologists.
Do you agree?
Yes, to an extent. I do not think it will replace psychologists. I do think it will replace some of the things that we do, and I don't think that's a bad thing. I don't know about most of the people here, but I did not spend most of my life in grad school to do notes or to argue with insurance companies, right? Those are things that we can utilize AI for. It should replace some of that. Like if I'm trained to be a clinician and a researcher, if I can spend most of my time to do those things, why wouldn't I outsource to something that can do those things that don't really need my skill set? I think about, how we use our phone. For many of us, when I grew up, when I was in elementary school, I had to remember and memorize phone numbers because we did not have cell phones like that. Now it's all in my phone, and I can pull up my phone on a cloud or pull it up somewhere else, so I don't have to memorize 20 plus numbers. That is a way that we can think about how we can outsource some of our cognitive functioning to be able to put it into AI, to be able to use it that helps us. I can take notes on my phone on my grocery list. I don't have to have pen and paper. There are things that AI can support us with. So I don't think it will replace psychologists, but I think it can replace some of the things that we do that don't really leverage our skill set the way it could.
Do you feel that psychologists are sufficiently involved at this point in the development of AI? If they're not there applying the science of psychology to the products that are being created, don't we run the risk of the crazy things I shouldn't use that word, the strange things that we're already seeing chatbots do, for example, making things up. You ask a question and you get something back that is inaccurate or almost looks like it's a lie.
Mm-hmm. I personally don't think we're that involved. We're not involved enough, and I would like to see us more involved, and I think a part of that is really helping people to see that this is even something that exists. There's so many psychologists I know who didn't even know this was a field that they could participate in. I think being able to offer psychologists even digital literacy to know what is technology, what are the things that we need to build on. But I think there's a lot of work to also do for tech companies to see the value of psychologists. I think that there are some that see it, but we have a long way to go to see that you cannot build something that is in our space and not include us at the top level to build that, to make sure that you're getting what you need. And I think that for too long, tech moved past us. They were building it without us, and now we're coming in and saying, whoa, we need to be involved to make sure that we're doing the right thing for society.
It's in their best interest, I think, for technology companies to be bringing in psychologists with all our skill sets to ensure that they're building products that are actually viable, feasible, that the user wants to use and is going to do what they say it's going to do. Otherwise, they've spent a lot of time spinning their wheels and spending money building something, and nobody's going to come. So I think that's also partly our responsibility, too, is to start bridging those gaps, to get out of our offices and to be thinking about how can we help these companies do something that could be great and have a huge impact in healthcare. I think healthcare is one of the spaces that AI can have the largest impact. But how do we ensure, again, that the tools that we're building are safe, that they are efficacious, and so that they can address bigger issues like population health and hopefully even health equity?
Are these companies coming to you at this point, or are you reaching out to them?
We have some companies that come to us, asking for experts, and we have kind of a small pool of individuals that we pull from. So one of the things that we did is we joined the FDA network of experts. We're the only non-medical society that's part of this partnership. It allows the FDA to come to us asking for experts in a variety of different areas to oversee research or data. And what we did is we started a database and it was sent out. So and we use that database to then figure out where we can find specialists with these different types of, not just tech, but other types of expertise as well. So I encourage people in the audience, if you're interested in being more involved, to join APA's FDA network of experts kind of panel, so that we can refer you out to when we see these companies. But I would like to see more and more engagement.
I think it's a both and. Companies do come and they don't know what they don't know. So some of them do not come. They don't know what the value of a psychologist can be. In general, in the tech space, they're used to building things without bringing people in. So they're just like, we're going to build it. We know how to. We have engineers, we have software people, we have computer engineers. We can build this without you, until someone's like, hey, have you considered this? Or it's not legal for people to see someone across state lines, so you cannot build this to do that. So I think we need to be able to go to them and say, here's the value, and really demonstrate that. But I think there are companies who have learned lessons from other companies they've been a part of, who will say, let me reach out to a psychologist so I can talk to them and have a conversation and learn about how they can support what we're doing.
Any final words of wisdom to our audience, advice that you want to give to folks who are here?
I think I would just issue a call to action. I think sometimes when we think about AI and digital health, it feels very big and overwhelming. And I would encourage every psychologist in any of the work that you do to every day when you're doing that work to think about what is one way that I could be better, 1% better, have better quality, help this patient have better outcomes, and then think about how technology could be leveraged. I think that would make it feel more accessible for people to say, how could this encounter have been better? How could this paper have been better? How could this training for these students been better if we had technology that would have made things more efficient? And really then start building from there to get more comfortable with thinking about integrating technology and reimagining their role collaborating with technology.
I think I would encourage people to have an open mind and to be curious about how these types of tools could help the people that you work with. Because that's the ultimate goal. The ultimate goal is for us to help our patients, help their families, help their caregivers, help our communities to address their mental health and emotional well-being needs. And so how can we use these, again, as tools to extend that reach? Because we all went to school for a long time. And we really do want to do the best. And I think this is just the next evolution of how we do that.
Well, I want to thank you both for joining us this morning. This has been very, very helpful.
Thank you.
Thank you.
So now we're going to shift our focus to the classroom. To save time, we thought, we asked ChatGPT to write the introduction for our next speaker. It said he attended Harvard as an undergraduate. He went to Rice. It thought he is currently on the faculty at Princeton. He's at Carnegie Mellon. And it mentioned his notable contribution to the field of verbal overshadowing, an area he's never done any work in. So here's a more accurate introduction written by actual human beings. Dr. Danny Oppenheimer is an award-winning psychology professor who has taught at Princeton and UCLA and is now a professor of decision sciences at Carnegie Mellon. Professor Oppenheimer has received numerous awards, too many to list here, for both his research and his teaching, but I would note one. He won the Ig Nobel Science Humor Award, which recognizes achievements that first make people laugh and then make them think. Dr. Oppenheimer's work on how various forms of technology affect learning has garnered widespread attention both within the academy, including a paper on how taking notes on computers influences classroom learning. It's worth noting that this paper currently holds the #1 all-time altmetric score, which is a measure of impact of a scholarly article outside of academia in the journal Psychological Science. Dr. Oppenheimer will talk about his vision of AI as a tool for the classroom and as a building block for the learning experience rather than as a threat to students and educators. He'll discuss the ways in which professors can harness the power of AI to do the more menial work of education while challenging students to greater depths of learning. Please welcome Dr. Danny Oppenheimer.
Thank you so much for that kind introduction, and thank you to our previous speakers who have just been fabulous. So in the introduction, it was mentioned that I won an Ig Nobel Prize. An Ig Nobel Prize is a science humor award. It's not an actual science award, but it's still the most prestigious thing I've ever won, so it sits there front and center on my CV. And I was giving a talk out in the West Coast, and I arrived on a college campus to see flyers everywhere welcoming Nobel Prize winner Danny Oppenheimer. So it seems that someone in their marketing department, whoever was responsible for the flyers, had seen my CV and thought that the IG part in front of the Ig Nobel Prize was a typo, because that's the sort of typo a Nobel Prize winner might make on their CV. Anyway, I got to campus, I got into the room, it was completely packed, everyone was excited to see a Nobel Prize winner, instead they got to see me. But the best part of the story actually is that I told my mom, and she demanded that I get some of these flyers so that I could take them home to her, and she framed them and put them on the wall because, moms. So the reason I'm telling this story, aside from a shout out to my mom, hi mom, is that this was, we've been hearing so much about how AI makes mistakes. It thought I went to Harvard, I went to Rice, we hear about these hallucinations, and AI makes all these errors. Humans make errors too. And we don't say, oh my gosh, humans make errors. Let's not let humans in front of the classroom. Let's not involve humans in education. But AI makes errors, and we say, oh my gosh, why would we have this part of education where it's terrifying what we could do with AI? And I think this is important because there are things AI is really good at that humans are not. And there are also things that humans are really good at that AI is not. And the right move here isn't to say we should be going with AI or we should be going with humans, but rather to say that we should be giving unto AI that which is AI's and giving unto humans that which is ours. We want to strengthen what we're good at and cover over what we're bad at. And so that's what we're going to be talking about today. So AI is a tool, and just like any other tool, it can be useful or it can be not so useful. The tools we use change the way we think. They change the way we behave. And so we want to be always choosing tools that will influence our behavior in ways that are beneficial to our goals. So here we have a tool in this bowl of soup. And if our goal is to strain out the vegetables, this is great. And if our goal is to eat the broth, well, this is not so good. And so what I want to start out with is reminding all of you that all of the AI tools cannot be used for just out of the box in general, but they all need to be thought about in the context of your goals, your institution, your needs. So with that said, I'm going to talk about a couple of things today. First, I'm going to talk about how as a teacher you can use AI to help you be a better teacher. Then I'm going to talk about how students can use AI, or we can encourage students to use AI to be better students. Everybody here is probably worried a little bit about AI and integrity and academic integrity and cheating. That's something that's gone very viral in the past few months, and so I'm going to talk a little bit about that, and I'll give you some final thoughts. So let's talk about AI to improve teaching. Every time I end a class, I ask my students to write down something that they learned in that class that they thought was interesting, and something that they left class with more questions that they would like us to address. These are called exit tickets. They're fabulous. If you don't use them, I highly recommend them because they're great for students. But I have hundreds of students in my classes. And so I can read them all, and I do, but synthesizing that amount of information, that's not something humans are good at. But it is something that AI is good at. And it's not just exit tickets. It can be done for short answer questions on tests, for homework assignments, etc. AI can tell you what is it that your students are enjoying, what is it that your students are confused by, what are the common errors that they're making, and that can help you adapt your lesson plans to be more effective. A second thing you can do is have GPT give detailed feedback to students. Now, I would highly recommend that you do not outsource your grading to GPT at this point, because as we mentioned, GPT gets a lot of facts wrong. So I would not do that yet. Maybe someday in the future, but right now, not so much. However, GPT is really good at grammar. It's really good at argument structure, and it can give feedback to students about what they're doing right and what they're doing wrong in a way that if, like me, you have many, many students in your class, you can't necessarily give line-by-line feedback to your students about how they could improve their writing. And so bringing in these generative AI models to help you in terms of improving is a really useful way of going things about things, right? So the last thing I want to say here is students benefit from lots of examples. When we talk about analogical transfer and what we know about what helps students learn and be able to transfer what they've learned to the real world, lots of examples is sort of the key feature there. And it's not just that it helps with analogical transfer, but different students have different schemas, different backgrounds, and different examples will speak to different students in different ways. So one of the challenges as a teacher that I often have is coming up with many different examples that will speak to different students. And one of the things that AI does really well is generate lots of examples. Now, when you're using it for this purpose, you can't just use them out of the box. You have to read them, because a lot of times AI generates examples of things that are not really examples of the construct you're trying to create. So you have to double check it. But as a generative tool, it's fabulous, because you can go through and see all the many things that you wouldn't have thought of yourself that might speak to populations in your class that would otherwise not be reached. I also want to say, I find that illustrations, a picture's worth 1,000 words, we all know that. Illustrations are great when they are the right illustrations, and it can often be very difficult to come up with images that really speak to what you're trying to say. So far, every image you've seen in this talk has been generated by AI. All the ones on this page, the ones on the cover page, I will get away from that in a little bit, but AI can be fabulous, as you saw in the first talk, for generating great images that can really speak to concepts and give students a schema to work with. Now that's helping us as teachers, because we can create materials and better learn what our students are up to. But we can also do things to help our students as well. So one thing that I have found that really helps students learn is when students teach. Teaching helps you learn. Being forced to give feedback to someone else helps you think through and understand the concepts. And one of the nice things about AI getting a lot wrong is that it gives us an opportunity to have students give feedback to AI. So when you're generating all those examples, and some of them don't actually work, save the ones that don't work. And then give them to your students and ask them to criticize them, to explain what is wrong with those examples. And that process of trying to figure out, does this really apply or does it not, is really great for deep learning. And so a lot of times you can use AI to help students figure out what is going wrong. Another thing we can do, and this is great because we're psychologists, it would be harder to do in chemistry or physics or whatever, but AI is part of our purview, right? We're interested in how thinking happens. So how does human thinking differ from AI thinking? That's a legitimate topic for exploration in your classes. And the students these days are really into that. And a lot of times, by looking at the contrasts, it helps elucidate what humans are capable of doing. And in fact, I have a lot of demos that I use in my class these days, which involve students querying AI to try to understand better how humans think and how AI thinks differently from them. And if you have the right prompt engineering, you can even get the AI to generate responses of particular populations that are different, perhaps clinical populations, which you can say, don't use certain ways of thinking, have AI do that, and then have the students query them. And we just in the last talk saw these questions about how do we train students better, and this is an opportunity potentially to really make a big difference. Finally, engaging in information literacy training is super important. AI is great for many things, but as we've talked about several times, it isn't reliable, it makes errors. I mean, so do humans, obviously, but teaching students is about teaching students how to use AI responsibly and not get tricked by hallucinations is really, really useful. Information literacy, as we saw with the deep fakes in the first talk, are going to be really important in the future. And so taking AI and training the students explicitly how to use it appropriately is a really great way to teach students to be more effective. All right, so let's talk about what everyone probably wants to hear about, which is AI can answer all of my test questions with an A level. They can answer all of my essays with an A level. What's going to happen in the future? Everyone's concerned that students are going to start having their essays written by GPT, and we aren't going to be able to detect it, and that's the end of academia. But I want to direct your attention to this. This is a screenshot captured from a website that took me less than 5 seconds to find. And it's not new. It's not unique to AI, and that is that people have always been able to go to essay mills to have other people write their essays for them. I have worked at places where you could walk around campus and see flyers, I will write your essays for you. And they're just publicly advertising that. And that's almost impossible to detect, just as GPT is almost impossible to detect. This is not new. What is new is that it's a little easier and it's a lot cheaper for students to do it. So given that this is not new, we know that the best way to stop cheating has never been through detection. The best way to stop cheating is to not have students cheat in the first place. And so how do we do that? Well, there's a whole psychology literature on how to prevent people from cheating. The first is you set clear guidelines, and especially moving forward with AI, we're in the Wild West. Nobody really knows what is okay and what is not in terms of using AI to help them. If I use a spell check so I can spell my words correctly, if I use a grammar check, if I use a thesaurus, an AI thesaurus, is that cheating? Is that okay? So what you need to do is spell out what it means to be an ethical user of AI in your class for your purposes. Be very clear about what your guidelines are, and students will want to follow those guidelines. Second, explain to students why cheating is a problem, and not just in terms of why it's ethically a problem, which I'm sure you already do, many of you, but also why it's just so dumb. Right? It's so dumb. If a student is using GPT to generate all his or her answers, then when they go on, then that means that what they can produce is what GPT can produce. And what GPT can produce, well, no employer is ever going to hire a student to do it if GPT can do it and GPT is free. So if all you're learning is what GPT can do, then you are unemployable. So don't learn what GPT can do, learn what you can do. And that kind of logic speaks to students, and then they are more inclined to realize that this is a bad strategy. But finally, you always want to be a role model of the integrity you want your students to emulate. And so this is another big thing. Talk to your students about GPT, talk to your students about academic integrity. That's really the best way to stop them from cheating. Finally, I want to talk about the importance of authentic assessment. If it's not cheating to use GPT in your class, then students won't cheat when they use GPT in your class. Right? In the real world, students are going to have access to generative AI. That is the future. So what we want to do is teach them to be effective while using GPT. Right? That's going to be in their lives, and we want to prepare what they're going into their lives for. So here's the thing. Consider incorporating using AI into your assessments and your assignments. Help teach the students to think like psychologists who will have access to AI, because that's what they will be in the real world. So I have an assignment that is a brand new assignment. I haven't tried it, so take it for what it's worth. But I'm asking students to generate responses to prompts, their opinion on various prompts. Then I'm asking them to put that into GPT or Bard and tell Bard or GPT to give the counter-arguments and to criticize their argument. And then I'm asking the students to write a rebuttal to what GPT or Bard has produced. And that is the assessment. And they are asked to both turn in what is their original thought, what are the prompts they use to get criticism, what is it that the criticism looked like, and how did they respond to the criticism. All of that is submitted. And I'm actually evaluating them on how well they got GPT to criticize what they do. So they get bonuses if GPT does a good job of criticizing their original ideas and giving them good counterarguments. And they get further bonuses if they can then rebut those. And that teaches them to be able to use GPT effectively through prompt engineering in the real world, which is something that's going to be more and more important moving forward. And more than that, it's not cheating when they do it. It's actually part of the assignment. So that's another way that we can think about GPT or generative AI more generally and academic integrity. All right, I have some final thoughts. AI has made some amazing strides, and it's crazy how quickly it's going through. Everything I tell you today is probably going to be obsolete in a month, although think about the general principles that are coming through, because those will be, enforcing integrity by convincing people not to cheat will always be better than trying to enforce integrity in other ways. AI, though, isn't something to fear. This is an opportunity. Yes, bad things could come of it. Yes, there were going to be some errors. Yes, there are going to be speed bumps along the way. But we now have an opportunity to engage in better pedagogy than ever has been possible before in human history, and that's something to be really excited about. We're only limited by our creativity, and our creativity can now be supplemented with AI, which is even better. So the future involves AI, and make sure you're helping your students be a part of that future. And finally, I know you're all interested in psychology because you're here, and in the interest of gratuitous self-promotion, if you like comic books too, there's a comic book AI psychology graphic novel that you might like. So anyway, thank you so much for your kind attention.
Please welcome back to the stage moderator Kim Mills.
Thank you, Dr. Oppenheimer. That was really fascinating. and you've given us a lot to think about. As with all things AI, these conversations lead to more questions. Luckily, we have all of these incredibly smart people with us today to help answer some of them. So I'd like to invite all our speakers back to the stage for a short Q&A. Please welcome back Drs. Sethumathavan, Jackson, Wright, and Oppenheimer. So we've talked about the ways in which AI is being developed by big tech companies and the role that psychology is playing in that process. We've examined AI's current and future impact on clinical psychology, and we've heard about AI's role in education. Now, I want to play devil's advocate and ask you some questions that I think people in our audience might want to hear answered. So let's say that I am a practitioner, an educator, or a researcher, and I'm enjoying success in my work, and I don't have any plans to incorporate AI in any way. After all, these technologies are still experimental. I don't want to risk jeopardizing my research, my patient privacy, or student experience. What do you have to say to me?
So, first of all, those are all concerns that are valid concerns, and I respect that. When I started college, and this is going to tell you my age, I was in the actual first cohort at my school where everyone had email addresses. It was the first year. It was very exciting. Yeah, I know, I'm old. But one of the things that was, having been in that cohort, is there were many professors who said, newfangled email thing, I don't want anything to do with it. If you email me, I'm not going to respond because I'm not checking my email. I don't want anything to do with email. It's the stupidest thing ever. It's untested. Who knows what this is going to do? I don't know anyone who says that anymore. And I can't imagine a professor refusing to respond to email or not using email at this point and day and age. And I think that this is going to be the case for some of the new AI, is that it may not be, you don't have to use it right away, but someday it's going to be just standard practice. You're going to have to use it if you want to be part of society. Mm-hmm. And so what I would recommend is, hey, don't jump right in and throw your patients or your students into the deep end if you don't know what you're doing and you're not comfortable with it. You have to be comfortable with it. Mm-hmm. But I'd recommend you spend a little time playing with AI, playing with GPT or Bard. They're free if you sign up for various things, and play with them. And it turns out it's really fun. I think you're going to enjoy it, and you'll also learn it. And then over time, you'll become more comfortable and figure out ways as better and new AI comes in, and it has become tested, that you can adapt it into your practices.
I absolutely agree. I think it's natural to be afraid, but I say go for it and be experimental and use your own judgment. I mean, it's fine to not use it, but you have to try it first, right? To see whether it's good or not. And be critical in the sense, don't take things for granted. Evaluate the benefits. What can it actually help you? Will it actually help you differentiate yourself or your practice or your research from others? What are the efficiency gains with using something like this? Evaluate it on your own, but at the same time, weigh that against some of the harms, right? I always like to go through my internal checklist when I think of AI. So I always run through, basic things, right? Okay, fairness. So what's in the training data, right? What's missing? Can it discriminate between certain groups of people? So I think through those basic list of questions. Privacy. Does it adhere to GDPR and other existing privacy laws? What would happen to the privacy of data that I feed into these models? Because you don't want to put in your confidential and proprietary information to ChatGPT or anything, right? Because it might, be used for other things. So be careful about those. Transparency is something that I think about as well, right? Which is, can I understand what the model is doing, or is it an absolute black box? And granted, in some cases, it's too complicated to fully explain the underlying underpinnings of the model. But try to read system cards and other information that's available out there to try to understand what it's trying to do. And are there feedback mechanisms that are available wherein you can give feedback? You test the system and give feedback to the manufacturers of these systems. And especially If you're working with bespoke models where certain companies are partnering with you on model development, absolutely ask these questions and only then make a decision. And if you figure out that it doesn't work for me, fantastic. But if it works for you, fantastic.
And for our practitioners, is it sufficiently baked for me to start using now?
I would agree and say that I think it's okay to give it a try, to try it out, to see what works for you. I mean, we've experimented with a lot of things. At one point, we were recording trainings on floppy disks and recording them. Right now, we're uploading things to a cloud. How many people would never use telehealth, and now we're using telehealth to provide therapy and finding that we have effective outcomes. You don't have to be in person. So there's a lot of things that we experiment with. I think we're trained to have a critical eye. Use that critical eye, to your point. And, you know, we're not that great at holding a dialectic, even though we talk about it all the time. Like, it's a both and. I can be cautious and I can give it a try using that caution.
So you're all very aware of the benefits and the promise of AI, and we've talked quite a bit about that this morning. What about AI is keeping you up at night?
Well, I would say what's keeping me up at night right now, Kim, is the fact that my 18-year-old stepson's about to go away to college next week for the first time. But if I were to answer around AI, I think for me, my concern is that psychologists won't lean in, that they'll let the fear override curiosity and open-mindedness, and that we will just keep it at arm's length and that we'll be left behind, as opposed to the leaders that I think that we can be.
Mm-hmm. I think I care about skill acquisition and retention. You know, there's this thing called deliberate practice, which makes one an expert, right? And you say it takes 10 years to be an actual expert. And if you are bypassing all of that and relying on these technologies to actually create outputs for you, and then you just tweak here a little bit, and you're okay with that, what does it lead to the basic skill acquisition, especially if you think about, you know, creative realms, you know, anything from writing to, you know, visual arts, music, you know, all of these realms, right? So what does it do to skill acquisition, skill retention, and all of these, you know, the beauty of these professions? And will it even lead to homogeneity? You know, because if everything is AI generated, is it all going to look the same at some point, right? So that's something that I care about.
What keeps me up at night is the data that goes in is the data that comes out, and a lot of it's coming from the internet. And we know that there's a lot of bias and discrimination that's already in this data that's being then kind of put into these models. And not always, you know, it's not an intentional thing, but it's what's out there. And so they're pulling the data from the internet that already has these things. And so that keeps me up at night, that we're creating something that's just going to keep reproducing these harmful effects on people. And so I would love to see more people getting involved in raising those concerns and being able to advocate and speak up so that it doesn't keep me up at night.
Yeah, and taking the flip side of that as well, it is now possible to mass produce misinformation very quickly in a very easy, plausible sounding way. I mean, AI, of course, has these hallucinations, and that's bad enough, but it can be asked to create things that are false as well. And it now would take a couple of hours to produce 100,000 websites all purporting to, you know, choose your, you know, whatever it is, that squirrels should be our overlords. I mean, it doesn't really matter what it is we want to say. You can create websites like that with fake citations to fake scientific articles. Those fake scientific articles can be written and posted on other fake websites that are supposedly real, you know, scientific repositories. And I worry that unless we train our students effectively in information literacy, that what we call fake news today will seem trite in 20 years, because the internet will just be completely full of false information, mass generated by AIs. And then to follow up on what you said, future generation of AI that pulls the information from the internet will be pulling the fake information into its training models and believe it is true to the extent that it has belief at all. And so it will create a self-perpetuating false information cycle.
Mm-hmm. If I may add to that, critical judgment would be so important going forward. So if we adopt a very lazy sort of an attitude towards the outputs of these systems and take it for face value, that's going to be hugely problematic. But unfortunately, if you look into the psychology literature, we know that humans have strong automation bias, right? So we actually trust a lot of the outputs of AI systems, unfortunately, much more. In fact, the trust in an AI-human relationship is actually opposite the way in which a human-human trust progresses. So it's quite unfortunate. So how do we help people overcome these automation bias is very important. And there's only so much of things one can do in the user interface of these systems. I think there is an equal responsibility from citizens when as you said, like literacy. Everyone should have citizen literacy is so important.
This whole area of technology is unregulated at the moment, and I'm just wondering if there were some kind of regulatory body overseeing it, what would you want that body to do? What do we need the manufacturers, the creators of AI, to be doing now to make it safe and ethical? Because we missed the boat on social media and a bunch of other technology that's out there, so maybe we could get ahead of it for once?
Yeah, well, the EU is coming out with the EU AI Act that's going to pass this year. I think that it will give manufacturers like 2 years or so of grace period, I think, to start adhering to these requirements. But they do talk about high and medium and low risk AI, and it expects manufacturers to adhere to a certain set of requirements. But as someone who practices in the industry, and I have always worked in companies with lots of resources, right? But now think of your startups and all these like smaller companies with not as much resources or the ability to translate a lot of the things that are written in these regulatory requirements, converting that into what does it mean to my everyday, right? How do I make sure as a developer that I'm adhering to these requirements? It's a hard thing to do. But the good news is things are moving at least in the right direction.
One of the things I would like to see is if there's any AI related to healthcare in general, especially even mental health care, that they are required to have clinicians that are a part of it. Because I think that's important as people are building things, that even if there's someone to help think about things like informed consent or think about what we're putting out, the information that we're putting out, I think it should be required, especially if there's a human on the end that will be affected. I think that gets lost sometimes when things are being built, that there's a human life on the end that will have the outcome of what we're building, and we need people who have actually worked with human lives to be able to impact that.
And I think piggyback on that, I think that these companies need to have ethicists as well on their boards to be thinking about these issues. But at the end of the day, you can have regulation, but if you don't have any enforcement, then what we're going to find is a similar problem that we're in with mental health parity, where we legislated it, but we have no enforcement mechanism to ensure that it takes place. And so we need to ensure that there is some enforcement mechanism when whatever type of regulation occurs around AI.
What about issues around copyright infringement? And I raise that because I know a lot of the folks here in our audience are published authors and are concerned about their work being scraped and reused and misused. What do we need to happen? What could happen other than Sarah Silverman suing everybody?
Oh gosh, that is a very, very tough, I don't have an answer to that because unfortunately all of these data sets come from the internet, so literally everything in the internet is used, right? So now anyone can create a piece in the style of Warhol or Picasso. Forget deceased artists, even living artists. So there is a lot of devaluation of the original and copyright infringement in whatever field. I don't have an answer to it. It's super complicated.
Is it too late already?
I don't know. I don't have an answer either. I agree. I think it's a complicated thing to sort through.
It's very complicated. I always, whenever I'm asked these sorts of questions, what I always do is, well, what is this for humans? We always think about AI and humans, and we probably can have a double standard, but what would we do for humans? And, I think about all the books I've read in my life that have influenced my thinking in ways that I'm not even aware of. And I sort of think, well, no one's really worried about that. They're worried about me plagiarizing, of course, but I've read so many things, everybody in here has. And I feel like AI is sort of on the same page with this, right? That AI isn't reproducing what other people have done. They're not word for word creating that usually. They are taking the inputs and then predicting what the population at large would probably say in response to certain prompts, which includes in it what people have said in the past. And I don't know how, in the absence of regulating how information that is out there could influence thinking, I don't know how you could ever control that.
Yeah, I have actually heard some discussions of having like a marketplace, the whole idea of a marketplace where people can opt in for their work to be part of part of the marketplace, and they get a royalty, each time their work is being used. But that requires an explicit opt-in, opt-out sort of a mechanism, right? And then on the other hand, you see very forward-thinking AI sort of artists, like you may have seen the news on Grimes. She openly saying, hey, I'll release a track, my fans should absolutely go ahead and remix, right? Using my voice, use AI to create their own music, but give me a cut from it, right? So there's all kinds of discussions that's happening in the industry, yeah.
Well, I'm afraid that we have run out of time. We're not going to be able to solve all of AI's issues here this morning, but I want to thank you all for joining me. This has been really excellent. I hope you've enjoyed what you've learned today. Where's the gathering place? In the exhibit hall, and continue the conversation either among yourselves or with some of our guests. So thank you again.
Thank you.